right, welcome back, everyone. You're watching CT Style. So Continuum of Care offers help to people challenged with mental illness, intellectual disabilities, or struggling with addiction.
That's right. And joining us is Director of Acute Services, John Lubinick. He's telling us what services are offered. Thanks so much for joining us, John.
Thanks for having me.
Talk a little bit about the legalization of marijuana and how that's fit into the puzzle of mental illness issues.
Yeah, well, marijuana unfortunately isn't great for mental health. With the legalization process, there's two issues really: potency and access. On the dark web, people can buy 100% THC, and on the streets, there's the synthetic marijuana issue that often is laced with things like hallucinogens, fentanyl, and angel dust, which can be problematic.
And I'd say, and I mean, if you're trying to overcome a mental illness, this would just lead to it or add more problems to it?
Yeah. With psychosis, the signs and symptoms are usually paranoia, delusions, auditory hallucinations, or hearing voices. And substances like marijuana that are specially laced or pure can just increase those symptoms of psychosis.
So who is most at risk? People who haven't identified mental illness?
Yeah. Well, the young adults, primarily with their developing brains, are at risk. Anybody with mental health histories, you know, knowing your family history, if there's a history of bipolar illness or schizophrenia, you can have a predisposition to psychotic episodes.
So what's the treatment like?
So treatment, antipsychotic medication is very effective in helping to reduce symptoms of psychosis. Therapy as well as psychoeducation for the individual and the whole family is really critical. But we also have a crisis residential program, which is the first of its kind in Connecticut, that's now working with commercial insurance. So that's a really great resource because it can help do the stabilization process in a home-like environment. Get those wraparound services in place so that when a person is discharged back home, they have the support and the services they need to manage if something does develop into a more serious condition like schizophrenia.
So I would imagine you're not just helping the individual, but providing resources and education to the parents and the whole family in dealing with that whole picture.
Yes. I mean, we certainly have an adage that if one person is sick in the family, the whole family is sick and needs help. And that's a positive thing, because if you get the support and services you need and you feel you're able to manage these things, families are much more comfortable having loved ones come back home.
Sure. And explain to our viewers, there's a residence at Continuum of Care. People can stay there and get the help that they need.
Absolutely, yep. It's 24-hour staffed. It's easy access to simply make a phone call and get a licensed professional on the phone to do a screening, do an immediate intake if there's bed availability, and really help to provide services immediately, because in instances like this, early intervention is proven to have better outcomes. So getting the help as soon as possible is really what we recommend.
Like instead of going to the emergency room, you would call?
Yeah. I mean, we could assess that on the phone. When things are caught early, we can certainly avoid emergency room visits and hospitalizations. Unfortunately, with psychosis, sometimes that is something that is needed sometimes. But if we have a relationship, a therapeutic relationship with the individual, we can often divert from hospitalization, which is key.
Give us your website real quick so people can follow up.
Yep, it's www.continuumct.org.
John, thank you so much.
Thank you
Such
so much.
important
Thanks for having
information.
me.
We appreciate it.
Very good. All right, stay with us. More Style coming up after the break.